Hey everyone, since I didn't get a chance to run through the live demo today on our call, wanted to do a quick recording of what it looks like inside the Bodyswaps app once you create your AI roleplay. So I'm launching into our roleplay now. There's a couple different options that the learner can pick from when starting their roleplay. Turn-based means that I'm going to click a button every time I'm ready to start and stop recording my voice. Automatic will automatically pick up on when I've stopped talking. This is best for quiet environments, so it's not picking up on any background noise. I'll go ahead and hit continue here. And it will load up the patient safety scenario that we built during our call today. Again, everything that you're seeing is customizable, so you can give the learner more or less instructions when they jump into the scenario here. In this case, this patient keeps trying to get out of bed, and I need to make sure that they stay immobile after their surgery.
Look, nurse, I've had about enough of staring at these four walls. I'm 30, not 100, and I've been taking care of myself since before you were born. My hip feels stiff, and I just need to get up and use the restroom on my own 2 feet without all this fuss. I'm not a prisoner here, am I?
Hi, Kenji. I appreciate that you are anxious to get up and get moving, but it's really important that we keep you sedentary, at least after your surgery. We don't want to have any complications and have you end up in the same place or requiring additional medical care. There are plenty of other things that we could do to help. Is there something that I can do right now to make you more comfortable?
Sedentary? You make it sound like I'm supposed to just rot away in this bed. I know my body, and I know I can handle a short walk to the bathroom. All this talk about complications is just a way to keep me managed like a child. If you want to make me comfortable, let me stand up.
We can certainly look at doing some alternative options like getting you a walker, or when you do need help, bringing in some additional resources. Would that be something that you'd be interested in?
A walker? Like some old man in a nursing home? That's exactly what I'm talking about. I've been walking on my own for 30 years, and I don't see why a little surgery means I need a cage on wheels. If I'm going to move, I want to do it properly, not with a bunch of resources hovering over me.
Okay, so at this point, I'm just going to end the scenario. We could keep talking back and forth. You can see that he was responding dynamically to what I'm saying. I'll click that I want to finish up this role play, and we'll now go to the body swap moment where I get to watch this back from Kenji's perspective.
Look, nurse, I've had about enough of staring at these.
Hi, Kenji. I appreciate that you are anxious to get up and get moving, but it's really important that we keep you sedentary, at least after your surgery. We don't want to have any complications and have you end up in the same place or requiring additional medical care. Perfect. So I can watch that whole thing, do some self-reflection, and then we can go ahead and go to our feedback. And so it will load up based on the assessment criteria that we put into the backend system. So I think we had 3 different areas of assessment here. And again, you can add up to 10 to assess during this. Now, I didn't have much back and forth here, so it might be quite limited, but we can take a look at this patient safety advocacy. So nicely done standing my ground regarding the safety boundaries and not letting Kenji get up unassisted. I really said that it was really important, but to improve, I could be more explicit about the immediate danger of a fall to ensure he fully grasps the severity of the situation. Collaborative problem solving, so great job suggesting a walker. So I'm giving him some alternatives. Next time I might try suggesting bedside exercises or offer some variety of different options. Again, whatever you put into the backend system to customize this, the better the feedback will be on the end for your learner. At the end of this, I'll then get to submit my transcript and my results to the tutor, and you'd be able to track all of this in the backend to see how the learners are performing. Any questions, just let me know.